Hi, this is Dr. David Tenner. We're here at the Goldberg Tenner Clinic in Atlanta, Georgia. And today I'm joined by Mr. and Mrs. Good, Linda and Randy. Linda's the patient, and we've been working with her for about 7 months, right? About 7 months. She came to see us in July of 2019. It's now January 2020. And Linda came from Pennsylvania, right? What part of Pennsylvania?
By Pittsburgh.
And Linda came in with some pretty severe health issues at the time. She had some very difficult problems, and she's doing fantastic now, 7 months later. So she's going to share her story with us. And so, Linda, tell us a little bit about what brought you in. What were you diagnosed with?
I was diagnosed with lupus, but prior to that, I've been diagnosed with ulcerative colitis since I was 17, so 32 years.
Mm-hmm. And there was one event that really set off kind of the downward spiral of your health back in 2010. Why don't you start there and tell us what happened, what led to these problems developing?
I went in for a routine colonoscopy in 2010, and the doctor had diagnosed me or said that I had healed colitis and that there wasn't any problems with it, but there was unsterile equipment when they did the colonoscopy, and I ended up with C. diff as a result of that, and ended up going down to like a little over 100 pounds, very sick, and they put me on Flagyl and Mincamycin and different medicines for that to try and heal everything up. But
so this was just a routine colonoscopy that you had?
Yes.
At the time, just to check and see how things were doing. And at the time, you were doing well.
I was doing well.
You had no symptoms, no signs of colitis,
problems.
no bleeding, no gastrointestinal distress. So a routine colonoscopy, and just to repeat what Linda said, the scope that they used had not been properly sterilized. And as a result, she got what was called Clostridium difficile, which is a very significant pathogen that causes debilitating illness, including significant ulcerative colitis. And as I recall, you telling me you almost died at the time.
Correct.
Correct. And then as a result of that, I was put on antibiotics, right? And that's my understanding that you developed colitis from this.
Yes.
They put you on steroids to suppress the colitis. And because the steroids suppressed your immunity, what happened with the C. diff?
I got it a second time.
And then as a result of getting it a second time, they put you on more antibiotics.
Put me on more antibiotics, and yeah, it made it even worse.
And so since then, as a result of a routine colonoscopy, you had ongoing ulcerative colitis since that time.
Since then.
Okay, and that was about 9 years ago.
Yes.
And then again, we got your history here, and it's complex. We're going through it one piece at a time here because a lot's happened to Linda. Yeah, she's a real nice lady, but she's really been through hell with all this. And then as a result, had been put on a number of drugs. I'm just going to read off the history that she wrote for us. Sulfasalazine, Asacol, Lialda, Entacor, which is another type of steroid. You had seen different gastroenterologists who had given you different things, but all the while you're still bleeding and having mucus and having a lot of distress. And then shortly after that, what happened with your muscles and joints? Tell us a little bit about that.
Then I started just all of a sudden started getting, I got up the one day and started having like just some pains in like my feet, and then each day it just kept getting worse and worse. It extended up to my knees, to my hips, my shoulders, till eventually I had inflammation and swelling all over my body, to the point where I couldn't even get out of bed without my husband's help.
Couldn't close your hands.
I couldn't close my hands.
You couldn't get dressed.
So your life, I mean, you really couldn't function at all.
I was very disabled in that aspect. I couldn't, my flexibility, moving, everything was very painful.
Ultimately, that led to a diagnosis of
Lupus.
lupus at a rheumatologist's office.
Yes.
Right. And they gave you,
They
looks
gave
like,
me Cymbalta. I'm sorry, but right before that, the medical doctor, my regular family doctor, tried to put me on a muscle relaxer, Cymbalta, just to try and help with the symptoms of everything. But then they put me on Imuran from the rheumatologist.
and it looks like 40 milligrams of prednisone.
And
Which caused hair loss.
yeah, I lost a lot of hair,
Many different
gained a lot of weight.
gained a lot of weight.
So this is just
Mood
one.
swings.
mood swings too. So this is one thing after another. Again, all that started you were in a state of good health, all started with just a routine colonoscopy.
Yes, correct.
All right, and this is, we actually, we see a lot of people with all different kinds of problems. This is certainly not the first time we've heard this story. And so Linda was really in rough shape when she first came in. Mr. Good, just shed light, because you're around Linda and you know her for a long time, and she's a real sweet lady. What was it like seeing her in such rough shape for
Oh, it's horrible. Having to try to help her get out of bed. It's a disruption to your life. There's no doubt about it. But you got to do what you got to do whenever you're married to someone. And it's painful emotionally as well to see your spouse, who's always been active, who's always, hey, what can I do? What can I get? And now she's laying in bed daily for hours on end. And so that's when we started looking for a solution other than the doctors.
And thankfully, y'all found us here in Georgia, and we take a much different approach than what they do medically. So we looked at your history, and so we really got to sort all this out. And rather than give you more pills and potions and colonoscopies and things that are going to create more harm to you, let's start the process of addressing these factors, these root factors, and then building health. And that was about 7 months ago. After all this history, about 9-year history of all this and all these drugs, you came in 7 months ago. Your C-reactive protein, which is a measure of inflammation, was high. We found a number of functional issues through the testing that we did. And what's changed now? 7 months later.
7 months later, I have no pain. I feel great. I can move, I can bend, I don't have any problem. The ulcerative colitis, the symptoms of that are completely gone.
So you got no bleeding?
I have no bleeding, no mucus. There's bowel movements are regular, normal. There's no diarrhea. There's none of that.
How many drugs are you taking?
And I take no drugs.
Zero pharmaceuticals.
Zero pharmaceuticals.
Off all the steroids,
No
off all the
steroids.
Inuran, off the
Yes.
Cymbalta, the muscle relaxer, and the other stuff.
Yes.
I tell you, that's quite a turnaround. Sooner than I was expecting, actually, in light of your history. It's quite a turnaround in just a 7-month period. So we've got a history of colitis here and lupus, and Linda is in excellent shape. We just did a physical exam on her today. All of her vital signs are normal. Her joints, there's no sign of any swelling or heat coming from them. Her bowel sounds are normal. We did an abdominal exam. It's really, really quite a remarkable turnaround. Mr. Good, what kind of things have you noticed with Linda just in the last 7 months?
She's happy.
She's happy. And Mama's happy. Yes,
Dad's happy. And the diabetes.
We forgot about that.
Yeah, it was causing borderline, actually putting her in a diabetic.
All those steroids that she was taking was putting her into diabetes. She had a hemoglobin A1C that was in the diabetic range. That's a measure of blood sugar. Diabetes is one of the most common causes of steroids is one of the most, diabetes is a common side effect of steroids, I should say. And so had you stayed on that prednisone and the other drug you were taking, the likelihood is that your health issues would have gotten far more complicated as a result of the side effects of the drugs. Because diabetes increases your risk of cancer and virtually every type of chronic health issue, and will further aggravate the autoimmune problems you have. They wanted to put you on Humira at one point, correct? Which is a biologic that can contribute. We've seen people develop tuberculosis and cancer from that. Now, as I understand it, your doctors, your rheumatologist, your gastroenterologist had told you were going to be on drugs for how long?
For the rest of my life.
The rest of your life.
Yes.
And it's now been 7
And I
months.
wouldn't survive without taking them.
You wouldn't survive at all without them.
Yeah.
It's been 7 months. We've had no drugs in Linda, and she's in excellent
Yes.
health. Her blood work, by the way, your hemoglobin A1C, which is the diabetic, the test that looks to see if you're diabetic, is now normal, right?
Great.
The CRP, which is important measure of inflammation, normal and healthy.
Yeah.
And the functional testing we've done on you as well, we looked at your stool micro today, looks excellent, looks clean, everything's good. So what has been a long, arduous, difficult journey, almost over a decade, has now culminated in a person who has recovered her health and who is doing all the right things to now stay healthy. We're thrilled with the results. And I've got to give Linda a lot of credit, and her husband a lot of credit too, who's very supportive through the process. We gave Linda a program to follow, and it was up to her at home to make use of it, to put the steps in place, to follow up with us, to work with us in implementing those steps, to make changes along the way. You had ups and downs.
Yeah.
Yeah, it wasn't smooth sailing the whole time. She had ups and downs. but she was very perseverant, and that's a key ingredient in the process of reversing chronic disease. So, is there anything else you'd like to add? Anything else we didn't?
We'd like to thank you.
Oh,
Yes, we very much appreciate it.
Thank you.
it's our pleasure.
Thank
It's our
you so
pleasure.
much.
We're delighted that you're doing so well.
We heard
What a relief.
about this down here, and we took their advice, and
I'm glad we did.
I'm glad we did.
Yeah.
We thought, are we really going to go to Georgia?
It's a long way to
I'm really
come.
going to Georgia for Pennsylvania, but
Well, we've got someone coming from Australia.
It was worth it. Yes,
Worth the
we've
trip.
heard of the out of country people. They've got us beat, but still.
Yeah, it's still a long way to come, and I'm glad you came.
Yeah.
yes.
Well, thank you for sharing your story. Appreciate
You're
it.
welcome.